Hello, good morning everyone. Today we are going to start a series of physiology lecture. The style of the lecture that we are going to adopt will be classroom teaching. In this series of lecture, every day we would be understanding one topic from the systems in details. And that way we are going to cover all the systems in physiology in details. The purpose for this is for you to have a very clear concept on physiology. And that is important because if you have a clear concept on physiology, it will help you connect to the clinical subjects, especially pathology and internal medicine. To get started with, we start with the first topic in the general physiology, which is homeostasis. Now, what does the term homeostasis mean? Now, if we go by the definition, the meaning of this homeostasis is maintenance of constancy. Now, when I use the term constancy, what do I mean? What is constancy? Constancy means like there are certain parameters of the body. The parameters that is essential in our body to maintain the physiological function of our body are the blood pressure, then we have blood glucose, we have temperature, and also various ionic constitution. Okay. Now, every day when we wake up in the morning, right after we sleep, there are certain changes that happens in the body. Say, for example, when we wake up, the heart rate changes, which also affects the blood pressure. Every time we have a meal, then also there is spike or increase in the blood sugar. But that does not make us fall sick. That does not make us go to the hospital. Have you wondered why? That happens because of the system that are helping in maintaining of the constancy. So systems in homeostasis. Now systems that are helping us to maintain the homeostasis are primarily of three types. They are the positive feedback mechanism. Then we have the negative feedback mechanism, and third we have the feed forward control system. Now, one thing that one must remember about this system is that none of this system is like so perfect that it will 100% correct the changed parameter. But all this system will make sure the normalcy, the constancy is nearly maintained. Now, we will start actually with the second parameter that we discussed here, which is the negative feedback system. Now, what happens in this negative feedback system? Here, anything that increases a response is immediately sensed by a special receptor which is present in the various blood vessels, especially in the aorta, and all of it we will discuss as we move into the systems. Now, this is sensed by the receptor which we call as the stretch receptors. See the term stretch. Stretch means when the blood volume increases, the blood vessel gets stretched, and the receptor in that feels that, sense that there is increase in the blood pressure. As soon as the stretch receptor feels it, what it does next is it immediately via centers in the medulla sends correction mechanism to the periphery, especially to the sense correction to the structures like blood vessel and the heart. So their function is altered, like the heart rate is decreased by a mechanism that we will discuss. The blood vessel also get dilated so that the blood flow also decreases. Now all this thing together will correct the blood pressure to near normal. Okay, to near normal. So what do we see? Whenever there was increase in the blood pressure, immediately via this reflex, which we call as the barrow reflex, there is correction of the blood pressure. A beautiful way in which this negative feedback mechanism work is also another very good example is also the hormonal or endocrine functions. Okay, so here in the endocrine functions, what happens? In the hormonal or the endocrine functions, what happens? Hormones, like whenever there is increase in certain hormone, like thyroid hormones, when it is increased in the circulation, it will decrease, or rather it will inhibit the thyroid stimulating hormone, as a result of which the further formation of the thyroid hormone in the blood will be stopped. That way the normal level of the thyroid hormone is maintained. Now, second, this negative feedback mechanism, how do we remember? There are like multiple examples, and the way to remember is by a classical mnemonics, like CLASP. Now this C actually stand for the mechanism of coagulation of blood. L is the LH, like surge. A is the action potential. S is the calcium entry in the sarcoplasmic reticulum, and P is the parturition. Okay, this is how we remember the maintenance of the normalcy. Coming to the positive feedback mechanism. In positive feedback mechanism, the whole mechanism is different. It is nothing like the negative feedback mechanism, because in positive feedback mechanism, here it is quite contradictory to the negative feedback mechanism. Here actually the normalcy is this disrupted. Yes, you heard me correct. It is disrupted. The normalcy is not at all maintained. What happens in the positive feedback mechanism? The thing that happens in the positive feedback mechanism is that this aggregates the response. Okay, and it is a vicious cycle. It is a vicious cycle. Vicious cycle means if this positive feedback mechanism is allowed to go on, then the homeostasis, instead of being maintained, it will get broken up. So few examples we are going to discuss here. Say a person suffers from hemorrhagic shock. Now, what is hemorrhagic shock? It is sudden loss of large volume of blood from the body. Now, if this happens, what will happen? This thing, it will deliver less blood to the heart. Okay. Now, when the heart see that there is very less blood coming to the heart, then it will start pumping more. Though the heart is getting weaker, here what is happening? This will actually weaken the heart muscles. When it weakens the heart muscles, the heart feels like it is not getting enough blood to pump to the periphery. So in this trial, in this process, it will try to pump. It will try to pump even stronger. So, this tendency of the heart to pump the blood, whatever is coming to it, though it is in very less quantity because the person is having loss of blood, maybe due to some accident, due to some mishap, anything. So, this tendency will further weaken the heart, ultimately causing arrest of the heart. So here you see, if positive feedback mechanism is actually allowed to happen, then rather than restoring the normalcy, it is pushing the person towards a fatal condition. The person is going to die. But this positive feedback mechanism is not only fatal, it is also useful in certain physiological processes. The useful part of positive feedback mechanism. Now, what is the useful part of this positive feedback mechanism? This helps in the example 1. It helps in the ovulation. It helps in the ovulation. How does it help? Here, before like 24 to 36 hours prior before to ovulation, the estrogen level increases. It becomes very, very high. Now, this estrogen level in turn increases the LH hormone, luteinizing hormone. That's a hormone. LH hormone to increase by many fold. Now, this increase, the sudden spike in the LH hormone ultimately it results in release of ova. So this is one physiological process in the body in which the positive feedback mechanism is actually helping. Another important mechanism in which the positive feedback mechanism is helping, that is example 2, which is the parturition. Now, in parturition, the role that the positive feedback mechanism plays, it plays via the percussion reflex. Okay. Now, what happens in percussion reflex? Here, when there is completion of the term, which is about 38 to 40 weeks of the pregnancy, here what happens? The head of the fetus pushes through the uterus, touching the cervix. Now, when that happens, immediately there will be uterine contraction and cervical relaxation. The cervix will dilate, it will relax. Now, when this happens, it opens up many oxytocin receptors. Now, this oxytocin receptors will allow the oxytocin to bind on it, and once it is bound, further the process of this uterine contraction and cervical dilation will happen. Further uterine contraction and cervical dilation will happen, which will push the fetus for parturition. So, these are actually two processes in which the positive feedback mechanism is actually helping. Other than that, it is not at all a normalcy maintaining process. In other physiological processes, it is the negative feedback mechanism that is helping to maintain the normalcy of the body. Okay. The third one, the third control system, which is also very important, is the feed forward control system. Now, this feed forward control system, it is quite different from the first two that we have discussed. Now, feed forward control system, the stimulus for it is not actually an actual stimulus. Like in the negative feedback mechanism, what did we see? There was an increase in the parameter, increase in the response. Means either the blood sugar has gone up or down, or the blood pressure has gone up or down, right? Same for the positive feedback mechanism also, there was a trigger, there was a thought. But contrary to both this, in the feed forward control system, there is no actual trigger or no actual stimulus. Then what makes it happen? It is most like, like a psychological thing, an anticipatory thing. Like you're thinking of something and the physiological processes already happen. Like for example, here the example one is like, say you are thinking of your favorite food. Suppose you are thinking of your favorite food, whatever it is. So immediately you, without even having seen it or smelled it or even ingesting it, there will be secretion of the gastric juice. I think I'm getting some reply. Let me just see. Okay. So this is how it works. Another good example of it is example 2. Like you think of walking, basically walking or even running, like any kind of motor function. Suppose you are thinking of any motor function without actually doing it. You are sitting in a place, you are thinking of it, or you are like actually running in a place and you are thinking of it, or you are just sleeping, lying down on your bed and thinking of it. As soon as you start thinking of it, the cerebellum the cerebellum starts coordinating and balancing act for the thought in which you have the activity to be carried on. Okay. Another example we can talk about here is also like if you go to a cold place. Suppose we were outside in a hot place and the temperature was like really high, and all of a sudden you enter into a room that is AC and it has been like pre-cooled and the temperature over there is like say below 60. So this sudden exposure, immediately what it will do, it will anticipate. The hypothalamus will anticipate and the hypothalamus will prevent the fall of core temperature. So, as a result of which, you may also start shivering. Okay, these are the few examples of the feed-forward control system. So, I hope the concept of the homeostasis is clear. So, what did we study in the homeostasis? We studied the control system, which is a negative control system, positive and feed-forward. To sum it up, negative control system actually maintains the normalcy or the balance. Whereas a positive control system, it destroys the normalcy or balance. And feed-forward control system, it is something which happens even when we are not actually getting the stimulus physically. The thought process is doing the activity. Okay. Now, our next topic, that is the body fluids. Our body, it is so beautifully composed. It has got solid, liquid, gas, everything. And the fluid that is inside our body, it's not only blood. Other than blood, there are like other liquid components also that runs through the body. Okay. Now, body fluid, it comprises in an adult, one thing here I must tell you. Now, hereafter, whenever we would be discussing like standard values, we will always mean these values in a normal 70 kg male who is an adult. Okay, not a child, not an old person, elderly person. Okay. So, in a 70 kg normal adult, What is the composition of the body fluid? The body fluid maximally contains the water. Okay. Up to 60% is comprised of water. It has got proteins, which is about 18%. This percent is in comparison to the body weight, assuming the adult, the norm is like 70 kgs of weight. And fat, about 15%, minerals and other allied compounds, 3%. Okay. Now, here we see in a normal 70 kg male, it is 60%, though it is slightly, different in case of females that we will come later. So, this 60% of water that is present in the body fluid, we call it as total body water. So, going by the formula or the calculation, 60% of 70 kg is how much? It is 42 liters. So, in an adult 70 kg weighing normal male, there is about 42 liters of water. Rest are the fat, protein and mineral and allied components. Okay. Now, how are this body fluid, this body like water and this fluid are oriented? Okay. So, see here, we know the basic unit in a human body is what? Is our own cell. Cell is the basic unit of our body that we know. So, say hypothetically, just in a simplified manner, say I'm drawing a cell. Say this is a human cell. The human cell is, it's not like a plant cell. Just a hypothetical diagram for our understanding. So, if this is a cell, here you see there are certain fluid that is inside the cell, right? And also there are certain fluids which are outside the cells. So, obviously, the cell which is within the cell, that is inside the cell, it is intracellular fluid because it is inside intra, and the one that is outside the cell, they are the extracellular fluid. Now, the next question that comes to mind is that are they all like in same quantity? Like, do we have equal quantity of this intracellular fluid and extracellular fluid? No, we don't have. It is that if we make in a flowchart form, it stands out to be like total body water. Okay, this is ICF or intracellular fluid, and this is ECF or extracellular fluid. Now, ICF, it comprises about 2/3 or 75% of the total body water. Okay, and ECF, it comprises about 25% or it comprises about like 1/3 of total body water. Now, if we understand it in percentage of the 60%, what do we know? Like 60% is the total quantity of the body water. So, in terms of the 60%, if we are to understand in a very simple way, okay, we don't even have to remember the other things. What do we have to remember? It is that like out of the 60 40% is in ICF and 20% is in ECF. So if we calculate, it stands out to be 28 liters here and 14 liters there. That is in the ECF. So 28 and 14, it is 42. So for you, it is just enough. If you remember, in ICF, we have 28 liters and in ECF, we have 14 liters. And you have to remember this because soon we will connect to the different condition in which this shifting happens, movement happens. Okay. Now, ICF is ICF. Within the cell, it is just this 28 liters and there are no further compartments or division. But outside the cell, there are various regions, right? There are various regions. So, this 14 liters is also again further divided into other components. Like in ECF itself, there are certain components. Like here, the plasma. In plasma, there is about 3 to 3.5 liters. Okay. Then there is this interstitial interstitial fluid, which is about 9.5 to 10.5 liters. And then we have the transcellular fluid, which is very less, which is about 1 to 1.5 liters. Okay, now what does this plasma, this interstitial fluid, this transcellular fluid mean? So very easy way to remember all this is, what is plasma? Plasma, it is the fluid part of the blood. Okay, now this plasma is about 25% of the ECF that we have. Second that we have is the interstitial fluid. What is interstitial fluid? It is the fluid present outside the vascular system. So since it is outside the vascular system, what it does? It includes lymph. Okay, it includes lymph. Okay, but not the blood. So interstitial fluid does not include the blood at all, though it includes the lymph. And where does it lie? It lies outside the vascular system. Then we have is the transcellular fluid. Now this fluid is present in the CSF. It is present in the as synovial fluid. It is present in the or as the pleural fluid, pericardial fluid. Okay, and also aqueous and vitreous humor, right? So basically, this transcellular fluid, which is like very little in quantity, only 1 to 1.5%, it does the function of, it does does the function of lubrication, and it prevents formation of any kind of friction within this area where it is lying. Okay. Now, there are certain methods to measure this one, because whenever there is any clinical condition, we're suspecting something, measurement of this becomes very essential. So, there are certain way to measure these. The first criteria, the first criteria is to choose a dye. Now, how that dye should be, when you are measuring something that has to be intravenously extracted, intravenously injected, like you have to push it inside the body, the first thing that one has to see is that the dye that you are injecting, it is it is non-toxic, non-reactive, okay, and it should be easily administered and easily measured. Now, this thing that we are discussing will help you to understand the practical part of the physiology also. That's why we are discussing this into totally details. So, the substances, the different body fluid, it's not that we can use a single type of dye and we can measure all the body fluid. No, it will not happen. So, what are the specific dyes which are already standardized and are in use to measure this various body fluid? Like the total body water. It is measured successfully by deuterium. Okay. Second, plasma by Evans blue. Third, the blood volume by like chromium labeled radioactive, rather chromium labeled RBC. Then the here the extracellular fluid. This one we study by inulin. The intracellular fluid we study by subtracting the extracellular fluid from total body water. These are the various methods to study. And there are certain formulas also. Like the formula to calculate plasma volume is blood volume into 1 minus hematocrit value. Okay, these are the formulas to measure the different body fluid. Here, when we study this body fluids, one thing we must remember, this body fluid also contains minerals, which is in small in numbers. So when we talk about minerals, what do we mean? The minerals we refer to are the like cations and anions, basically. Okay. And these cations and anions, they are the very important electrolyte which maintains the ionic composition of the body also. Now, the ECF, it has got sodium in largest number and ICF, it has potassium in largest number. And the distribution is not same, like it's not that the amount of the sodium that is present outside the cell is same like that of inside the cell, and all the same details also gradually we will study how and why it is like how and why it is affecting the cell in which manner, that we will come. So for now, just remember the major cation in the ECF is the sodium and the major cation in the ICF is the potassium. Okay, now all this thing is also impacted by substances which are not ionic, like the sodium potassium, they're in ionic in condition, like they dissociate whenever there is water, they dissociate in water, that we know from our chemistry knowledge. Now there are other substances also which are essential for life, like glucose. They do not stay in ionic condition. Okay. Now, presence of this glucose along with this sodium potassium does impact a lot in the ionic composition of the body fluid as well as the physiological response of the body fluid in various conditions. To understand this, a very basic concept of physics, which of chemistry, which is applied here, we have to remember. It is the concept of osmole. I'm sure most of you know what is osmole. Osmole means osmole. What is the definition, chemistry definition that we have studied in our higher secondary classes? The definition of osmole is like any substance which is osmotically active. Or if I try to make it even more simple, then what does it stand out to be? It means any substance that is dissociated easily in water. So how do we understand that one? Why the concept of this osmole is needed? It is very much needed to study the various hydrated and not so hydrated and dehydrated condition. What will be the electric, like the ionic condition of the body in this clinical condition whenever there is deviation from this normalcy. Okay. So say for example, glucose. It does not dissociate in water, right? It will not dissociate in water. It dissolves in water, but it never dissociates in water. So 1 molar of glucose contributes contributes to 1 osmole because it is not breaking down into any charged particle. Whereas if we take the example of, say, if we take the example of NaCl. So NaCl in water, what it happens? NaCl, when it is in water, it will break down into Na plus and Cl minus. Now, both this Na plus and Cl minus, they are osmotically active, right? So, 1 mole. So, 1 mole or 1 molar solution of this NaCl will give 2 osmole. Okay. Another example, just for our understanding, calcium chloride, what it will do? In water, it will break into calcium plus fluoride minus, right? And here, the calcium, it will be 2, right? So here actually, from 1 mole or molar of this calcium chloride solution, what we are getting? We are getting 3 osmole substances, like substances, 3 osmotically active substances we are getting. Now, in context to that, determinants of the body fluid I am coming. Let's understand this one a bit more. Like now, in context to that, 2 more terms we have to understand. One is the osmolarity and osmolality. See, these are absolutely chemistry terms, right? So, talking about chemistry, we know that if I have to think it in form of chemistry, what do I mean? It is like, it is the number of osmoles per liter of solvent, right? Per liter of solvent. And here, what does osmolarity means? Here, it is number of osmole per kg of salt. Okay, this is what is the definition in the chemistry. But see, our body, it is not a perfect liquid, means the body fluid that we have, it is not a perfect liquid, right? It has got like fat also, it has got proteins also, and then it has got glucose, it has got all those cations and anions. So the direct definition of this chemistry, it won't apply to our body, it will be slightly different. So here, within physiological limit, in a human body, this osmolarity, this osmolarity and osmolality, they are roughly used as same. Roughly they are used as same. Not very precisely, roughly they are used as same. So, here, when we are talking of this osmolarity, say osmolarity of glucose or osmolarity of a solution that has to be infused in our body. Okay, it usually means like osmole per liter of plasma. That is what it means in context to human bodies. And why it is important? It is very important to decide whenever there has to be any fluid infused inside the body, considering the condition of the patient, like whether the patient is dehydrated, if he or she is dehydrated, to what level he or she is dehydrated, and what is the cause of this alteration of the osmolarity or the osmolarity, all this thing. Another concept that we have to understand here is the osmolality gap. And it is very important in the diagnostic tools. So this is of course a lab function. Osmolality gap, it is the difference between the calculated and measured osmolality. Okay, and this is normal value is less than, it is less than 10 milliosmol per kg. Okay, now here when we are counting the osmolality and we are thinking in terms of plasma, we use it in kg. The SI unit that we use is kg, because osmolality and osmolarity in physiology can be interchangeably used. The error is very less. Now, what actually causes increase in osmolality gap? Like, what is its significance that we have to study that? It is seen that this increase happens when there is unaccounted osmotically active substances. Suppose due to whatever reason there is increase in the sugar like sorbitol, mannitol, or there is also increase in substances like lipid, protein. In that condition, the osmolality gap will be more than 10 milliosmol per kg. Okay, the conditions, the common conditions in which osmolality gap increases are hyperlipidemia, hypercholesterolemia, and also in elevated sugar in the blood. Okay. Now, further extension to this osmolarity and osmolality, we will continue in our next class. How the shifting happens, we will start with what is the normal osmolarity of the plasma. From that we'll start. Now, another thing that is needed to discuss, remain to discuss, is the determinants of the body fluid. What determines the body fluid? In normal condition, we have seen that in a 70 kg adult male, 60% is water, right? Now, in same 70 kg adult female, it is seen that there is about 50 to 55% there is water. So what can we say? One of the essential or important determinant is like sex. If it is a male, the water content is more. If it is a female, the water content is slightly low. That is assuming both are healthy, fit and fine and perfectly okay. So sex is one of the primary conditions. Determinants. Second determinant is the body fat. is body fat. Now, the above example also connects to this determinant body fat. We know that in females, the subcutaneous fat is more. In females, the subcutaneous fat is more. So, the water, the fluid is less, comparatively less than that of the male. Because generally in male, the lean muscle, that is the skeletal muscle, pure muscle, is in higher quantity compared to that in a female. Third determinant is the age. Okay, now this is an important thing that one must remember. How does age affects? It is seen that in children, children means from 1 year, like toddlers rather, like right after infancy, from babies, toddler, all the way until they attain puberty. Until they attain puberty in children, until puberty, both male and female have 75% of body water. That's why prevention of dehydration is very important in children. This is also one of the reasons you would have like very commonly heard, right? If there is hyperthermia in children, means both male and female until they have attained the puberty, what we do? We tell the child to be made sure that he or she drinks enough fluid, enough, ORS, so that the hydration is maintained. Okay, so these are the important determinants of the body fluid. So the points in today's lecture that we covered is from the first chapter, homeostasis, body fluids, the types of homeostasis we discussed, the various types of the body fluids we have discussed, the determinants of the body fluid, and the various locations of the body fluid. So hope this is of use to you. You understood. In case you have any doubt, please feel free to text me whenever we are having the session. Tomorrow, I will continue with the osmolarity. We will start with the osmolarity of the plasma and we will discuss the shifting of the fluid, how it is affected in various conditions when the water level in the body is increased or decreased. Okay. Thank you. See you tomorrow.